Hello, I'm Lena, and thank you for joining us for Connecting on Purpose, where we hope to connect you with our work, but also the amazing people doing the work. And today we're so excited to have Doug Weeks. Doug is our Baptist Health Executive Vice President and Chief of Strategy and Innovation. Hello, Doug.
Hey, Lena, how are
Thanks
you?
for joining us.
You're welcome.
So, Doug, you've been with us for 32 years. Tell us, why did you choose a career in healthcare, and why did you choose to do it with Baptist Health?
Sure will, Lena. So, like many students, you're out there trying to figure out what you want to do with your life. And I actually had a friend of the family that was a hospital administrator with a science degree. And I, at that point in time, had a science degree and had been to dental school. But he had migrated towards a business career in healthcare administration. So I researched that. And that, combined with the fact that I was dating my future spouse, caused me to stick around in New Orleans and obtain a degree in healthcare administration. I had lived in Little Rock as a small child growing up, and always had an affinity for Little Rock and the Arkansas area. And my father, a Baptist minister in this area, had not cared for the sick, but visited the sick and the ill and prayed with them many times at Baptist Hospital. And many times I was in the waiting room while he was making rounds. And so I just remembered Baptist Hospital and throwing out resumes. I had one stick here in Little Rock. And so that's the story of me being at Baptist. But it's been a great place for me. The Baptist footprint is so large, and there's so many opportunities within the system that it's just been, for my career, it's been a really good fit.
So this year in February, Baptist Health turned 100, and you've been with us for many years. And so tell us what you believe Baptist Health's greatest contribution has been to the community. And I know we decided to just really focus on the pandemic more than our anniversary, but what are our plans to celebrate this year?
So, Lena, there's been many great contributions that Baptist Health has made to our community. I think the one for me that stands out the most is our ability to care for the sickest of the sick. On a daily basis, Little Rock or North Little Rock campus, Fort Smith, Conway, will all receive patients from all across the state, especially here in Little Rock. And those patients come to us in a situation where they had been referred from, just the skill level, the specialist needed were not present. And through the years, Baptist Health has an array of specialists, great nursing care that's enabled us to really take care of those really sick folks. And it was never more evident how beneficial we are to the community than during a pandemic. Yeah. Because many of those COVID patients were transferred to us from around the state, and we have more ICU beds on the Little Rock campus than any place else. More critical care physicians, more intensivists, more specialty trained nurses. And so I've always been proud of the fact that we can take care of folks that other folks and other entities aren't able to care for. So I think that's been the greatest contribution in my mind. We've done so many interesting things from a technology perspective, from new equipment. But at the end of the day, we're the place you need to be when you're really sick. Yeah. And that's what I've been most proud of from a Baptist Health perspective.
What will we do to celebrate?
Well, interestingly, we had a curveball thrown, and that was the pandemic. We were going to celebrate a 100-year anniversary anyway. But when the pandemic came and when the vaccines were put in place, and when the need to deliver vaccines was thought about, we had ordered, and thankfully the foundation had raised the dollars for purchase of a mobile van, and we already had that in the making, but we've shifted, and so rather than doing healthcare screenings and cholesterol checks and blood pressure monitoring, we're going to go out and we're going to have at least 100 stops this year around the state of Arkansas, and we're going to be vaccinating folks. We're going to try to help the state overcome the COVID crisis. We've already started this past weekend. I think we did close to 1,000 vaccinations with our new mobile van that the foundation put in place for us. So that's how we're going to celebrate our anniversary. I think it's a fitting celebration.
And we'll be going into underserved and rural areas. doing that
Absolutely.
too.
That's the reason we got that's the reason why we purchased the mobile van, so we could go to places that were as or less accessible than, you know, a community that has one of our hospitals located in it. So, you know, we pride ourselves on being accessible, but we never want to stop becoming more accessible. The mobile van is going to help us do that.
So this month marks 1 year that our nation and our state has been really fighting this pandemic. How has it affected you personally and professionally? And do you have any words of wisdom or encouragement to share with everyone?
Well, Lena, I think the impact of the pandemic was more professionally related, in that it so impacted what we do on a daily basis. We were less strategic initially and more just trying to figure out on a day-by-day basis how to get the testing done, how to make sure we've got the capacity to care for this influx of coronavirus positive patients. And so we put a real emphasis on kind of disaster management. You know, we've had disaster plans all along, but you never have a disaster that lasts for a year. And so, you know, it became tiring. You know, there was not only burnout at the bedside with our caregivers, but, you know, I know that many folks in leadership positions just, you know, it's 7 days a week, 24 hours a day, worrying about making sure we had enough beds and enough staff. And what if any of those we run out of, and what do we do? What's going to be the backup plan? So I think the longevity of the disaster mode took its toll to a large extent. I think on a personal level, we just sort of buckled down and did what you have to do. You know, everybody pulled back, and you spend more time with your wife and your dog. But other than that, it was fine. Well, I think for today, we want to continue to be cautious. You know, our caregivers, they set the example. You know, a patient comes to Baptist Health, they want a safe environment. We have to be on our toes, and we have to set the standard for a safe environment. And we're not really hearing that we should back off on, you know, our safety protocols, our masking, our gloving, our shields. So we're keeping all those intact. However, obviously we're seeing a decrease in the number of patients that come to us that are coronavirus positive. We're seeing a decrease in the active cases statewide. So I think that it does appear as though there's light at the end of the tunnel, and I'm optimistic that we can get back to the new normal, as we've used the term we've used so often, maybe too much. But yeah, I'm very optimistic that we're close.
Yeah, good. Anything else you'd like to share, Doug?
So I do want to encourage everyone. The vaccine is safe. There's been multiple studies about the safety of the vaccine. Baptist Health has its own Center for Clinical Research. We were involved in the development of a safe vaccine, so we're very well aware of the safety factors. So I encourage everyone to go out and be vaccinated. It will, you know, it can make a difference. It really can, because this is a horrible infection. It's impacted most everybody on a personal level, myself included. So why take the chance? So go get vaccinated.
Thank you, Doug, and thank you for joining us.